Hi everybody, Evan Marsh from Capillary PT in Malta here again. Here with our friend Tom, kind of going through this series of videos discussing this regional interdependence conversation of how one body part may be affected by other areas and moving or not moving as effectively as we want. I want to first start out by kind of giving credit where credit is due to Kyle Kiesel. I took a course online through MedBridge. He's a PT, PhD, and an athletic trainer. And so I wanted to make sure that I kind of gave him his due as to taking this philosophical approach to how we may go about looking at different parts of the body. So as I discuss this, know that again, it's something that PTs are, across a wide area may be using this concept, but not to say that he necessarily coined this idea, but this is where I maybe utilize a little bit more my approach towards this. In the first video, we discussed a little bit of how to maybe look at Tom's shoulder. We looked at having him lie in his stomach and assessing his external rotation, kind of this Apley test, and we found that he was having some motor planning issues on this right side. So we're going to now look at his upper back mobility a little bit differently. To kind of review, he was again able to passively go into this full external rotation flexion posture, and passively I could bring him there. Actively he was having a difficult time. So we look at that as a motor planning deficit. But now we're going to look at a way to kind of look at the loading onto his spine differently. So I'm going to ask Tom to come into an all fours position here. Now, to really get an isolated look at the lumbar or thoracic spine, I want to make sure his lumbar spine is locked out. So having him sit towards his heels here really helps to limit the amount of movement coming from his lumbar spine. Now we're really able to assess just thoracic mobility up here. So I'm going to just kind of stabilize his hip so that he doesn't sway side to side and give us any compensation here. And it's time to take his hand and put it towards his waistline here. So I'm going to hold, and I'm going to ask Tom to rotate up. So I'm stabilizing very mildly, and again, that's full and clear. Any pain with that?
Nope.
No problem. Coming back down. And again, about 50 degrees of rotation is kind of what we look at as normal. I'm going to ask him to do the same thing on the other side. A little bit harder to go through. A little uncomfortable with that?
A little bit.
So a little discomfort, but he's able to get through the motion. It's the full 50 degrees, so I look at that as good. I'm going to show you some modifications of how we may be able to assess that same motion if a patient's not able to get in this position. So Tom, why don't we go into hands and knees here? Now, if someone's low back is really limited, and I'm still confident that it's maybe an upper back, thoracic region, immobility or motor planning deficit, there's other ways to look at this. So don't think that there's really just one way to stop. So we can do the same rotational stretch or kind of a assessment here with his hand towards his pelvis. And again, going through that, we would be able to look at the same kind of mobility. We can even have him come up here and go through that same rotation. A couple things I don't love about this position. A lot of patients will kind of cheat by squeezing their scapula together too much, and that can create a little bit of a kind of impingement-like symptom or kind of report by the patient that their upper back's really uncomfortable. If their pec's really limited, this position might stop them. That's not a bad idea and good concepts to look at, but I prefer, if possible, to look at it, again, in that kind of lumbar lock posture. And very lastly, if we need to look at it in a different way, I'd have Tom sit up over the edge. I'd get behind him on this one, stabilizing his pelvis again. I'd have him put his hands on top of his head here. And again, I'm just kind of looking at the quality of movement. How can he rotate? And again, having my hands here gives me a lot of feedback and a lot of information. It tells me, is he using his obliques well? Is he maybe happening to flex his spine at all? Is he overextending in the lumbar spine? I'm really looking and seeing, can we just get good movement here? So again, a couple concepts, couple ways to kind of look at this. The next part of the video series that we'll look at is we'll look at lat testing, and we'll take from there. Thanks very much for watching. Have a great day.